Okay, don't get me excited. Let's get me excited. All right. And here it's going, guys. So it is starting up right now. What I do is I'm going to just let you both know that we're going to, I'm going to monitor kind of the feedback on my phone. So welcome. We are officially live. And I want to introduce to everybody on our live webcast, Facebook Live here. We're Zoom casting. I'm with Alex Rakshani and Jim Godin from Team EXOS. They are the therapists that really make it all happen after the treatment. And I want to just kind of let's have Jim start out. And Jim, introduce yourself to the audience here.
Yeah, so my name's Jim Godin. I've been with EXOS since about 2011, and I'm the director of PT for the legacy facilities, and then on the PT sports med side of things.
All right, perfect. And then Alex, tell about yourself.
I'm Alex, physical therapist. I'm born and raised in Tampa, Florida. I work very closely in the Regenexx Tampa Bay office with doctors Torrance, Lieber, and Pappas, and enjoy working with them on a daily basis, helping improve the lives of their patients and getting them back to doing what they love.
All right, fantastic. And Jim, where did you go to school? And tell us a little more about that. Tell us about your history and your life path to finding Team EXOS and being the proverbial badass that you are with Team EXOS.
Yeah. So I'm from Maine. Grew up, born and raised up in Westbrook, Maine. And then I kind of spread my wings to really see the world and went up to University of Vermont for PT school. I did undergrad and PT school there, actually. Phenomenal program, very small program. I think we had probably 18 folks in my class. And during PT school, I had an idea of what I wanted to do. And then I was on holiday leave, probably my sophomore year, and I was watching Fit TV back when that was a thing. And I saw EXOS doing some FMSs at the EXOS Los Angeles location. And at that point, I was like, well, that's what I want to do. So 2 days later, I started talking to my clinical instructor, the person in charge of it at University of Vermont, and we set up a contract with Athletes Performance at the time. And essentially went through the screening process, got lucky enough to get selected, went out to Athletes Performance in Arizona in 2009 as an intern, hung out there during Combine. After that was over, I was lucky enough to go be an intern with the Dodgers. When Sue was up there, she let me come up for a while and help out. And then after that, I went home, graduated, ended up going back to Maine for a little over a year and worked at Southern Maine Orthopedics, basically. And it was a phenomenal experience in that they had 3 operating rooms right there. And I saw a ton of post-op. And some good advice I had when I was a student is you just need to see a ton of post-op. You just need to grind them out, understand what good looks like, what bad looks like, and understand sometimes you just need to hold the line and be consistent. And that was pretty much the first year of my existence as a PT. And had great insight there, worked with some phenomenal PTs, ATCs, and strength coaches. And after that, I got a call, and Athletes Performance at the time, again, was looking to get into the tactical space. So I went down and took over as the PT down at Special Operations Command Central in Tampa, located at MacDill Air Force Base. We were able to grow that program. I hung out there for about 7 years and kind of went up to the director of the Human Performance Program. We were lucky enough to work with some of the best people in the nation, some folks that are just humble professionals, and I learned a lot as a person, but also I got to use some pretty cool stuff from the performance and PT side, from elite form to conduct, Omega Wave, HRV, whoops, whatever you want, we were using. And that was a phenomenal experience. And again, that also ingrained, no matter how many toys you have, the bottom line is you have to bury yourself in the basics. And you can't ever leave those. So the fundamentals of human movement don't change no matter what you have for a budget or a facility. And that's why where I'm at now in Fishhawk, we're at CrossFit for Glory in a beautiful CrossFit box. We don't have all the gadgets, but our outcomes are every bit as good.
Yeah. Well, it's awesome. And I believe, I met you right after you were leaving Soxent, and actually had the pleasure of going on base. And and everybody there loved you. So, you know, I heard fantastic things about this guy, and people were like, you got to meet Jim. You got to meet Jim. So super fortunate and super pumped that we got to meet. And then as fortune would have it, we had some similar ties, and I've been working with EXOS to come on board with our Tampa location when we opened that up. And I believe August, almost like a year and a half, like almost 2 years now. Or, I mean, it's almost been 2 years essentially.
Yeah, it's been a minute.
Yeah, so at that point we brought on Alex, and Alex, we were amazed with your resume. You came from orthopedic office, and just kind of tell us a little about how you found your path to working with EXOS and working with our clinic.
Yeah, so unlike Jim, I haven't been all over the country as such, but I'm very biased to Florida. I've got an excellent family and great group of friends here. Love the weather. I'd consider maybe California. That's kind of weather-wise and similar situation to Florida. I always, as far as graduating school at USF, I was really interested in orthopedics, not necessarily sports per se. I found just a lot of joy just treating people like my brother, my dad, my buddy, not necessarily professional athletes, or though I've had some experience with that. And just all ages of life. So I like the variety of working with, little kids. They can be tough to handle, but you got to make it fun. You got to make it exciting for them. All the way to, that 9-year-old lady with a walker. And kind of as Jim alluded to before, we're all, that little 5-year-old kid, he's got to stoop down to pick up his ball to go throw it. And then, that lady has to also bend down to, slip her foot down into the shoe. So the patterns of movement, across ages, across activity, they stay, pretty consistent. And then even within sports, you have a higher intensity, incorporating, more speed, coordination, which add a little bit more of a, performance layer to it. But when it comes down to it, we all got to perform at our day-to-day life. So, but I do enjoy that variety. And, I think what drew me to Regenexx and the EXOS here, I've just kind of going through grad school. EXOS was kind of like, ooh, that kind of ooh-ah kind of clinic there. I was kind of, I enjoy the sports, but I enjoy that variety more. And, in talking with the management and, this specific position, it was kind of geared to, the everyday person. So I kind of took to that, and, the rest was history.
Yeah. Well, give me 1 second, because I want to write down something real quick. And I didn't clean my board off. So every one of the patients from the thing that I love about EXOS, and I want to kind of discuss that with everybody. I was doing a reorganization of the Major League Baseball last night with my father and my brother on the board. So what I wanted to explain what the difference is, and in life there are good and bad practitioners of everything, right? And what I want people to realize is that with EXOS, you can expect an extremely quality product. Just like with Regenexx, you're going to get a quality regenerative product, really top of the line. With EXOS, you're going to get that same quality product. And some of the things that I want to make sure that everybody knows. It's one-on-one with a physical therapist, right? And that is really EXOS. All right, that's really unheard of in this space. And I just want to make sure that anybody comes on here, takes a look at this later, pops on here. Please make sure you, if you're in Fishhawk area or you're in the Wesley Chapel area, these guys are the best of the best. They don't need a referral from myself to actually see you, and that's something that's really beneficial. So if you ever have something going on with your body, you can't figure it out. Physical therapist, just like a good coach, That's why Tom Brady and Bill Belichick did so well for so long. You need somebody to look at your movement pattern and identify what the root cause of that problem is. And that brings me to my next kind of discussion topic that I wanted to throw to Jim. And Jim, what is the pillar system you talk about from EXOS, and really understanding what that is? Kind of, could you break it down for me and give me some bullet points here to explain to people what we're looking for?
Yeah, absolutely, man. So essentially, when you go to an EXOS Physical Therapy and Sports Medicine, we're all playing from the same sheet of music. So a couple years ago now, we kind of boiled a bunch of stuff down and created what we call the EXOS Pillar Prerequisite Form. And it's based on two fundamental principles of movement and performance, which is force absorption and force propulsion. And what that breaks down to is kind of flexion, rotation, and extension, rotation. And when we say flexion and extension, that's referencing the closed chain foot, so the foot that's on the ground. And then rotation is related to the T-spine. So for instance, for force absorption, we would expect to see kind of midfoot pronation, calcaneal eversion, tibial internal rotation, flexion internal rotation, ipsilateral T-spine rotation, ipsilateral glenohumeral extension IR, right? So these are things in contralateral C-spine. So like when we look at absorption, those are the things we know we need to be able to do, right? And very quickly, it's it's synchronous, and we just kind of break it down to these pieces. Extension is everything in the opposite direction, right? So we have supination, inversion, tibial and femoral external rotation, right? And then we have T-spine rotation away. So we kind of look at those two pieces, and then our pillar prereq form takes those two fundamental patterns, and then we break it down piece by piece. So we go through, it ends up being 22 pieces. We test you in varying positions. So we start with your feet on the ground and do a whole global assessment. And then we get you on the table. We do it in seated, prone, supine, and quadruped. So that way what we do is we take away body parts, we take away gravity. So we actually know what's going on. We also test active versus passive range of motion. And then once we take all this information and we kind of put it in the buckets, we break the pieces down to whether it's more of a tissue compliance or joint dynamic dysfunction. So we need to make a tissue more loose. We need to mobilize a joint, or it's neuromuscular. Like you have the motion, your body just doesn't know how to use it. And that saves us some time, right? Yeah. So you say, hey, bend over and touch your toes, and they can't do it. If we sit there and stretch the heck out of their hamstrings, but then in the course of our pillar prereq, we realize their hamstrings aren't tight, right? We can lift it all the way up to the moon. They just can't lift it up actively. It's more of a pillar prereq issue. So then, or neuromuscular control rather. So that kind of helps us be very efficient in our treatment techniques. It also allows us to take people through the paradigm of, hey, they come in, they're painful, we're regressed a little bit. We understand, hey, for instance, Dr. Torrance does a procedure on their knee. That's phenomenal. So they come to see us and we're like, well, why did that knee hurt? In the absence of trauma, right? So then we start digging in. Hey, what's ankle dorsiflexion looks like? What's femoral internal and external rotation look like at 90-90 and prone, right? And then what's T-spine rotation look like? So we start layering this picture. So while we might be, I'll say babying, but we're appropriately linearly loading that knee, we're also cleaning up the parts above and below. So that way, these little pieces, once we get down the road, months down the road in terms of the performance paradigm, we've cleaned up all these little issues that might put a roadblock in once we want to layer on that kind of that force velocity curve. So, it goes back to, detail oriented is what makes people a good practitioner. That's kind of what it boils down to, right? And then the little tools in your toolbox to kind of create the changes you want. So that's kind of the broad strokes picture of the form we use. And again, every therapist does it. We've been trained up on it. I've lived in it for a little while now, a couple of years. And it's very linear in thought, and it allows us to kind of standardize the global picture of how we look at kind of physical therapy and really kind of human movement.
Jim, could you give an example? Oh, sorry.
Yeah, perfect. Yeah. So, Alex, jump in. That's a great example, Jim, and I appreciate you explaining it. So just kind of giving an understanding, like these are things that quality therapists are looking for in your movement patterns. And when I talk to patients, I go, listen, you're not gonna like what you're saying right now is like it's on my level, but I'm sitting here going like, the general population, they sit there and go, you know what? I don't understand it, but you know what? You get me feeling better, Jim. And that's really the key. And he looks at all this stuff, and this is what's going through his head as he's looking at you. And that's why I love this so much. Now, Alex, give me a good example for somebody that, typically would come in. I call them industrial athletes, right? They've been working their whole life. I had a perfect example today. A guy with a biceps tendon. I treated his shoulder already. He's been doing well, but his biceps tendon is now flared up. I think he's got that kind of perfect upper cross syndrome, where he's got the tight pecs. He's got the weak neck muscles. He's got all that kind of going on. And kind of, Alex, could you kind of touch on that and touch on what you're going to say here about, a good example?
Yeah, I was going to, just kind of lean towards an example of, because I'm sure a lot of patients are out there and they're like, okay, well, if, I had this pain in my shoulder and I got a procedure done on my shoulder, why are we, why are you looking at my upper back and my thoracic spine? And what our evaluation system is designed to do is look at regional interdependence, because a shoulder issue a lot of times is not necessarily the result of, a direct, specifically an injury to the shoulder. So, we have patterns of movement and, flexion with, movement patterns of the shoulder. If you can't extend your T-spine, your thoracic spine, well, you're not going to be able to get that arm overhead. So if you can't, arch your back, get your back and chest wall up, it may be more difficult to reach up top. And that inability to, and then that kind of forcing through the reaching movement may put a little bit of, extra tension on that shoulder, irritating that bicep tendon. So even though the bicep tendon itself is inflamed, the fact that the patient isn't have appropriate thoracic spine mobility may be what's causing that irritation of the shoulder. So combined with, we not only, yes, we would work to reduce the pain, reduce the symptoms, and help facilitate the procedure in that area. We're also looking at, the full body picture, because, you can't have one without the other.
Absolutely. And this is exactly what my problem is, and with my shoulder itself. You guys you're describing exactly. I feel like you're picking on me right now. But no, this is a very common problem, especially with really what I like to call the vanity muscles from that we were so in high school, we were all taught to develop, right? Your pecs, your chest, your shoulders, and it gets us to really neglect those posterior muscles of the rhomboids, the serratus, your lats, and it really creates a scapulothoracic dysfunction. And I think all shoulder issues are scapulothoracic dysfunction at their base, at their core. And that's why working with Jim and Alex, it makes me so happy, because I can confidently refer to either of these two fantastic clinicians and expect them to really put each of the patients through a quality workup that's one-on-one, and give them, you get video exercises to take home so that you continue to do this. And your homework is just as important as working with Jim and Alex themselves. Jim's probably mad at me because I haven't been doing my homework as much as I should, but we're always our worst patients, and Jim and I both know that about each other. So and I'm sure Alex agrees. We're probably the worst to ourselves in life, but no, yeah. So really, Jim, you jump back on real quick about post procedural. We're changing tissue, and how do you facilitate that process from a regenerative perspective? We touched on the SANS criteria last time, I think, and it really kind of goes along with exactly your pillar pieces, and talk about how it facilitates the regenerative process.
Yeah, so I think we all agree that kind of load is imperative for the regenerative process, right? And linear load for sure. So essentially, like we were saying earlier, let's just use an example of the folks that you sent over for the knee, some ACL, some meniscus, some OA, CrossFitter wanting to get back to the CrossFit games, right? big gentleman, former Division I football player, great athlete. Knee just hurt. I mean, it was to the point where he was having a hard time driving the truck. So you did your thing. We took a look at him. And like I kind of alluded to at the beginning, like at the beginning stage, we actually saw him right before he went to see you. So we identified a lot of these little biomechanical issues. Shooting from the cuff, I believe he had ankle dorsiflexion. He also had limited great toe extension. That's kind of like a feather in the back of the cap. He just hurt. I mean, it was the point where he was having a hard time driving. Oh, yep. Sorry, a little feedback there. And then, he lacks femoral internal rotation. His T-spine was stiff like yours. So before he ever even had the procedure, we started mobilizing the heck out of the ankle. We started getting some band mobilizations, some soft tissue love up in those hips to get the tibia and the femur rotating a little bit better, extending better, flexing better. You did your thing. We hit him up. And then the good thing was, like, he was a little swollen at the time right afterwards as normal. So we're still able to say, hey, let's get that ankle moving. Let's get that hip moving. Let's get that T-spine moving. So we literally lost 0 time in the rehab spectrum.
Yeah.
For this particular gentleman, once we kind of clean up the pieces, and this goes for anybody, whether it's the 94-year-old woman you sent over or this fella, we clean up all the little pieces and make them better. At the same time, the regenerative process that you've stimulated is happening. And then once kind of the pain is subsided, we generally use a 0 to 3 as our kind of acceptable pain range for stimulation versus probably some deterioration, or at least setting them back a little bit. Then we start linearly loading. And with the procedures you do, I'm very linear in my approach to the loading strategy. And we do it in 3 planes. If it's a knee, we'll usually do some posterior chain hip dominant movement first, right? So just so they start receiving weight in the legs, they regain that comfort. And then we slowly start working that shin forward. And we kind of get that forward shin angle, more knee dominant type movement. Once we've, again, cleared all the little pieces, ankle, hip, T-spine. And that's kind of an example of the loading strategy. And then for this particular person, we took him through all the way the performance paradigm, right? So we got him back down to med ball work, so we could work on force propulsion and absorption in a dynamic manner while we're still maintaining the particular shapes that we want. And then we worked him into low-level plyometric stuff. So drop to base, just how can you dynamically control your weight? Then we had him jump up to boxes, jump down from boxes. We worked on bounding. And we also, because he wanted to get back to lifting heavy, we took him through a traditional strength program as well, linear in nature, triphasic. So we had some eccentric block in there. And he did an isometric block. He did quite well. That's just one example of a person, but independent of the pathology, that's how we approach it. So we clean up the parts. That's number one. It's like Alex was talking in that case of that shoulder. Heck, if you have a bicep tendon and your scapula can't posteriorly tilt, and your T-spine, when you raise your arm up, that T-spine can't rotate, C-spine can't rotate towards that direction, then you're gonna have a problem. So, we clean up the parts, which is get that posteriorly tilt, clean up that tissue, let that scapula posteriorly tilt. All of a sudden we work a little CT junction, some upper T-spine stuff. All of a sudden that opens up and they can extend. All of a sudden, in particular, just say, for instance, Ron Torrance had some stiff T-spine, and see like, hey, that doesn't hurt. That doesn't really impinge that bad. Well, what we've just done is we've created space for when you go in and do your thing, give that a regenerative technique. It's no longer impinging. So what you did isn't currently getting jacked up. It's going to keep getting better over time. So our job is just to kind of create the canvas so you can go do your work. And then we have the fun on the back end, which you don't get to do because, Alex and I get to take people through med ball and plyo and sprint mechanics. You know what I mean?
Well, I'm glad you went there. And Alex, you want to pick this up for a second? Because I started a watch party. I've never done this before. So I started a watch party on the Tampa Bay Beach Bums. It's all the volleyball players. And tell me something that, you would see in a beach volleyballer that is something that you would recommend them to do to really help them make sure that their knees, I see a lot of beach volleyballers with knee issues or shoulder issues, right? Give me something to bulletproof their knee or bulletproof their shoulder that would be a take-home piece, because there may be some people watching that would really benefit from this. And just in case, I just started this watch party. It's Alex Rakshani and Jim Godin. They're with Team EXOS. They have locations in Fishhawk, and there's one location at our office in Wesley Chapel area, Tampa, right by USF. So Alex, take something there for me real quick.
Yeah, so one of the easiest and quickest ways for symptom modification and improving muscle length is the foam roll. So we use that quite a bit as our pillar prep. And, you know, for potentially somebody with knee pain, you know, we'd want to, depending on what we get on that pillar prep exam, but just some, you know, easy off the cuff, you know, advice would be, you know, loosening up the calves. That helps the.
Did I lose you? What happened?
He's frozen. Looks good though.
He looks great. It looks like he's
He
really,
does.
really good there.
Somehow he got in to get a haircut.
His wife's doing it. Alex, am I losing you? Your home internet's not doing it for us. Well, Jim, I think we're gonna have to take. You and I are gonna take this one. Can you hear me still?
Yeah, I got you.
All right. So Alex, we lost you. We're gonna continue on with Jim. So Jim, he was talking about foam rolling. I think it's super important. If he's frozen, we need to let's give some volleyballers what they can do to get themselves ready for a match.
Yeah, man. So you know, our pillar prep is essentially soft tissue mobility and stability. But the biggest mistake people make, especially when we get a little, you know, older in age, we have a whole bunch of stuff like a job, significant other, kids, stressors other than the recreational sport we're going to go play, is all of a sudden we start deciding on the weekend we can turn it back on, right? Yeah. Like that switch doesn't happen. I don't know if you were watching Last Dance right now, but like Jordan came back after playing baseball and he was a little out of shape as he got into the playoffs. And then that next day he was back in the gym because he wasn't going to let that happen again.
No.
Sometimes we all fall into that. So I'll see it when I go play, you know, rec league softball. People show up and just go get it. You know what I mean? Yeah. So in terms of like your weekly stuff, certainly soft tissue, trigger point, foam roll, the calves. We know if ankle dorsiflexion is limited, sometimes you can get some pain in the front of the knee that you just don't know why. Get those quads loosened up. But the biggest number one thing you can do is show up 15 minutes early. Go ahead and Google world's greatest stretch. Go ahead and get that in. If you have some mini bands, get your butt muscles turned on, and then work on some plyometric stuff. So drop to 1 foot, drop to 2 feet, get yourself good and warmed up, get a good sweat going before you ever hit the sand. If the sand's not going to stick to you, you haven't done your job. So you want to be out there warm and ready to go. If all of a sudden you're using the first couple points to get yourself warmed up, you've lost. Like that's when you're going to start getting, you're not going to be any good. And B, you're just going to get injured.
Yeah, you know, and that's a great point. Alex, welcome back.
Sorry. Good thing I sent this to my personal computer because this other computer just shut off randomly. So,
hey, no worries. Jim picked up the pieces. We're good. This is why we're a team, right? This is a collaborative team here. So this is exactly the thing. We can go back and forth, help each other out. And you're exactly right, Jim. I've played, you know, I play on the open level volleyball, which is, you know, if you can make it into an AVP event, which is the Professional Beach Volleyball Tour, I play with some of the guys who are pretty good and they make that. So, but you know, if you don't come out the first 5, you know, if you're not warm, you're not sweating, the sand's not sticking to you. That's a great term. I'm going to keep that because that just reminds me so much of The Last Dance. We could have a whole discussion on The Last Dance, but that will not happen tonight because that he touched on it. I had tears in my eyes at the end of episode 7. I think everybody else did.
Oh yeah.
But to compete, you have to be ready in all aspects. And I think that this foam roller, the perfect stretch, I think these are exactly very good examples for anybody who is watching this from the Tampa Bay Beach Bums page. There's over 5,000 members on there who play beach volleyball and a super active population. So that's a great example. I don't want to keep you guys too long unless you guys want to touch on something else. Alex, Jim, I usually do like a 30-minute thing. You know, I'd be happy to have you guys back because I really enjoy kind of just geeking out about things. And maybe we get some good case examples for another in a couple weeks and go from there. How's that sound to y'all? You there?
Yeah. For anybody, I mean, local to Wesley Chapel or Fishhawk, if anybody has any questions, reach out. We have a Facebook page out here in Fishhawk. You can call us 813-737-8550. We do free injury screens. So for your volleyball folks, you know, we know for overhead athletes, if they lack flexion or total arc, they're more likely to have an elbow injury, shoulder impingement. We'll screen that stuff out for you and get you squared away. So we're community first as a company. That's the biggest thing that we need to get past is while we are for profit, our biggest piece is we need to serve folks, and we take great pride in that. So if people are needing some advice, reach out, and we're here to be an asset for you.
Yeah. And I don't want to put this on you guys right now, but I am the medical director for a postcard in beach volleyball tournament in 2 weekends. We are practicing safe social distancing. We're doing screening. But if you guys would ever want to pop out there, Regenexx we're going to be on site doing all the medical staffing, making sure everybody's safe, healthy and safe on the beach. But you be welcome to pop in and say hello. We'll be there. Alex, you want to give a last shout out to how to get a hold of you if they're looking for a screening or those kind of things?
Yeah, so I'm located in the Regenexx Tampa Bay office, 8600 Hidden River Parkway, Suite 700 in Tampa. It's on the corner of Fletcher and I-75, right there, right when you get off the highway. So we're easy access from Wesley Chapel, New Tampa, USF, Temple Terrace. I can be reached at 813-400-0630. And it's a nice, savvy little business line. So you can call and text that number. Obviously with any, questions, information, if you want to talk with, a therapist specifically, we're very open to that. We're here for the community, and, we're here to get people better. We want people to, get back to doing what they love and move at, their best, the most efficient, best performing self.
Fantastic. No, these guys are really top notch. Really, I truly appreciate having them in the tool belt and working with collaboratively. We're a big team. We really just want people to get back to really doing the things they love and doing that without pain. There's too many people that pain has become their mistress, for lack of a better term, and it really defines their life. They're trying to stay out of pain, and they don't want to do anything to put themselves in new pain. And with this team and with our treatments, we've really been successful in hundreds of thousands of patients, and we continue to see more and more patients each day who have really just with quality therapy, regenerative medicine. It's definitely turning the tides of chronic pain in this country and keep people off opioids. So I thank you guys for your time. We'll talk more really to figure out another time to get both of you, either one of you. I'm happy to have you both. Really love both of your guys' inputs and knowledge. And thank you guys so much for being on tonight.
Appreciate you guys' time. Have a good night. All right.
Okay.
Peace, guys.